That's a good catch. Go, 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 go. That was a good catch. Go, 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 go. That's a good catch. Go, go. That was a good catch.
And hello and welcome to Inside Lincoln Hospital, heart and soul of the Bronx. In this episode, we're going to be talking to the CEO of New York City Health and Hospitals, Lincoln, Cristina Contreras. We'll be walking through her early beginnings, career journey from social worker to CEO, community work in the Bronx, and all the latest updates at Lincoln Hospital. I'm the Dr. Bob Lee, and this program is brought to you from BronxNet's a brand spanking new media and technology studio and New York City Health and Hospitals, Lincoln. Cristina Contreras is in the house. They give you a little, like a little tour.
Oh, no, not yet, but I'm going to do it right after this.
You got it. All right. Well, we'll be sure to take you around and show you everything that's brand new right here at the studios. To start things off, can you tell us a little bit about your background and what it's all about? I know we met in our past and we did some things together, but give us a little update.
Sure, Dr. Bob. Thank you. I really appreciate the opportunity to be here with you today. So I'm an immigrant, very similar to our patient population, born in the Dominican Republic, born and raised in the Dominican Republic, came here when I was 15, and spent most of my time in the Bronx, which is why I'm considered a Bronx person, but became very interested in the social work field, healthcare very early. I always wanted to help the people that needed the most help, and felt that social work would be a good field to do that, and been in healthcare ever since. And my trajectory got me here to where I am today.
Let's see, Jacoby Hospital. What's some of the other places you
I was
were?
at Coney Island Hospital, which is now South Brooklyn. I was at Jacoby Hospital, North Central, Metropolitan Hospital, Manhattan, and recently started working as the CEO of Lincoln Hospital 3.5 months ago.
Yeah, September 2024.
Yes.
What have been your top priorities and your main focus?
Well, the first thing I did when I came into the hospital is assess the staff. I'm very interested in staff engagement, so my number one priority is to make sure that the staff feel validated, supported, heard, and that they feel that I'm there to support them, so in turn they can support each other and support the patients. I also want to make sure I work with the clinical leaders to develop the strategy for not the strategy, but the goals for the hospital, and enhance some of the clinical services that we have, not only improve access, which is critical for the South Bronx, but making sure we work with the patients so they can understand how to navigate access.
That's important too, because a lot of people come in and they're like, oh,
it's
where
overwhelming.
do I go from here? Yeah.
It's overwhelming.
Yeah. The Bronx is known to have its challenges with residents being able to, or not being able to access quality health care. How do you create the awareness in your position?
So it's a kind of a marketing with the team to make sure that the patients have, not only that we create the My Chart, that they can navigate, put it in their phones, but they also have an opportunity to request appointments, to request information. They can access some of the medical records so they can see. Because sometimes when you go to the doctor, you have a lot of conversations. It could be overwhelming. So they have an opportunity to review what was discussed with the provider, some of the medications, some of the instructions, and if they want more information, they can request it. So using technology is something that we do. We do it in the hospital. We're also planning to do a massive campaign of information for the patients to teach them how to request access, how to come in, when to follow up. I want the community to know that we rather that they come and partner with us to do the primary care as opposed to just wait for the last resort and come to the emergency room. Listen, we're going to take care of them anyway, but I'd rather they do their appointment, they make their appointments and see the doctors on regular checkups, regular times.
Yeah. Cristina, do you have an open door policy?
For us, yes. We definitely, right now, we see everybody that walks in. Everyone that comes in is either seen in ambulatory care. Hopefully, if we have access to see the providers, they can see the provider. Otherwise, we have a team that sees them, assess them, triage them, and either see them for the presenting problem and then connect them with the primary care.
I know we're going to learn more and more about Lincoln Hospital.
Yes.
Yes, yes. Well, now that you're there, Thank you so much for all that you do in our community.
No, thank you.
We're going to take a quick break, and we'll come back and educate our listeners and viewers more
Okay.
next. And welcome back. I'm Dr. Bob Lee. You're watching Inside Lincoln Hospital, the heart of the Bronx, with Cristina Contreras, CEO of Lincoln Hospital. Now, we were talking about the community is very, very important to you, but
Yes.
I want to, before we get deeply involved in the community or talk more about it, what are some of the things that you offer at Lincoln Hospital? Some of the programs.
Yeah, absolutely. We have medical services, primary care. We have obstetric services for women to have their babies, GYN. We have a cancer center. We have pediatric services. We have ambulatory surgeries. We perform a lot of different surgeries. We have family planning, geriatric services. We have a lot of specialties as well that are available for patients. So I really want people to know that we're here to service them, and we have, as far as I know, we have all the services that they need, and they don't have to leave the South Bronx to get them.
There you go. And of course, people are going to be talking about these services in our community.
Of course.
Because you're going to be out there letting the community know, creating the awareness that Lincoln Hospital is in the neighborhood,
Yes.
and you can take care of everything, all your needs right there at Lincoln.
Absolutely, Bob. I'm making an effort like this one to collaborate with community partners such as BronxNet to make sure that people are aware that we're here to service them. Lincoln has an excellent history of providing services, 177 years of providing services to the South Bronx. We kind of like just doing more marketing now, bringing it awareness to the community, partnering with community organizations, community leaders that have the same goals that I have, which is to make sure that we have a healthier community. I want people to know that we want to partner with them to keep them healthy. Because at the end of the day, our main interest is not to have patients inside the hospital. You know, the landscape for healthcare has changed.
Yeah.
And we need to make sure that we keep people healthier together. Doesn't mean that they have to be in a hospital bed.
Right, right. So what are some of the things that people can do for preventive care?
Well, it's specifically working with the doctors, making sure that they follow the recommendations. Everybody's, I guess, health is different, and the risk is different. The knowledge and awareness is important. That's why it's good to have the discussions with the provider specifically, and they'll give you a plan. They work with you, and we want to make sure that we also use virtual care. That you don't necessarily have to come in physically to the doctor all the time. You can have a virtual visit and have a discussion with the provider. Unless it's something specific, the recommendation will come for you to come in. We even have virtual care, virtual express care in the health system, so that's good. Even to go to the ER.
Now, they didn't have that back in the day.
Oh no, no, but we had
Express
to.
care.
But we had to take advantage of technology, and trust me, someone like me, I work in a hospital setting, but it's not necessarily that I want to see the doctor all the time. But sometimes you have concerns. You can even call a number and get consultation over the phone, and if it's something that, depending on your history, you might just get a prescription over, they send a prescription to your pharmacy of choice.
Now, how does that work? You set up an appointment and you go through it like that, and the person is right there.
Yeah, there's different ways of doing it. If you just have a virtual visit, that's an appointment set up. And you're ready, your provider gets online, the nurses do the pre-screening, the discussion, and they prep you and prep the doctor for the visit. Other than that, if it's something emergency or urgently, you can also do a virtual express care and call in and talk to a doctor like an emergency room.
There's a lot of diabetes out there and other degenerative diseases.
Yeah.
What can you tell our public about maybe trying to get on the right track and eating a little bit better and taking better care of themselves?
Oh, yeah. Let me tell you, Bob, that's one of the things that we're planning to do with this initiative, which is great. I'm going to have different providers discuss different
All
topics,
right,
specific. We're trying to target it depending on the month and discuss specific diseases that we want to make sure that we bring the right education, the professional. Because trust me, I'm not necessarily the expert. Obviously, I would always tell you that you have to follow the guidance of the providers. They know best and work with you, right? Because we all have different cultural diversity that has to be considered. Because I don't, some of us, like, we eat certain foods. And
we love the foods that we eat.
And we love the food that we eat. And even within that culture, they need to tell you what's healthier, what are the healthier choices. So I would always recommend, and I encourage people to follow this program. We're going to have it once a month, and I'm going to have different experts, different providers, clinical leaders, expertise to come and talk to you about the different approach that you need to take depending on the disease. For instance, we have an expert we have a research provider. She's the director of research, and I already spoke to her because it's important. It's a lot of research that we have at Lincoln that the community doesn't necessarily know, and that sometimes provides access to some clinical trials, some important medication that could be, a state of the art for you. So again, those are kind of like the approach that we're taking, and this is why I'm here. I'm here doing an introduction to the heart of the Bronx, Lincoln. I want to make sure people know that we're here. But in the future, I want to bring experts.
So, I think that's a great idea. You're right on point. Because you can put the community on the same page as what Lincoln Hospital is doing, and vice versa.
Absolutely.
I like it.
Absolutely.
So our community will get the opportunity to learn a lot about Lincoln Hospital. And Lincoln Hospital will get an opportunity to learn about what's going on in the community.
It's always important. It's a two-way street. We can tailor or equip ourselves with resources, programs that are specific for the community unless we hear what the community needs and what are some of the things that they need as opposed to what we assume or we make the decision for them.
Why Lincoln Hospital?
Like I said to you, we have a variety of services, not only primary care, but specialties. Lincoln is an iconic place. It's a beautiful place. It's been serving the community for over 177 years. We do amazing work. It's a level 1 trauma center. It's one of the busiest trauma centers, not only in New York City, but it's the third busiest trauma center in the nation. And we see approximately on an average, you could see close to 150,000 people in the emergency room alone. That's an impressive number. I feel for the staff, but they do an amazing job. They're very committed. They love what they do. They're here to serve everyone in the South Bronx and anywhere where they come from. But the reality is that the cases that we see there are, a reflection of what's happening out there, which is one of my main concerns. This is why it's so important for me to highlight, for instance, one of the major programs that we have, which is Guns Down, Life Up in Lincoln, which is great because talk about partnerships with the community. They do a lot of the intervention that needs to happen. They do respond. They do community engagement in terms of education, being there where they need it the most. And they're one of the programs that we feel very proud because they really do the hard job that needs to be done out there to prevent those emergency room visits, for instance. There's a lot of crimes happening, unfortunately, with our youth, and the victims of crimes or committing the crimes. And this program is very targeted, very specific, very resourceful in terms of knowing, the community, who the people that are more vulnerable, and kind of reaching out to them, even when they come to the ER, because some of those visits that I was telling you, unfortunately, are a lot, crime related, and it breaks my heart to see that. But at least we're here to service them, but we also want to be preventive. We want to prevent.
Yeah, and when you say level 1 trauma center, what does that mean when it's level 1?
You have a whole variety of resources that have to be part of that. Like we have, obviously, the surgery department had to be up notch. We have to have a level of specialty services responding. It comes with a comprehensive set of resources that need to be available for any type of trauma that we get, because you don't predict, and you can, it's not like having, okay, you have this specific service and they're coming to you. You actually have to have all the resources available for any type of trauma that you receive in the hospital. And having that resource in the South Bronx is very, very important. It's critical. And we need to make sure that we have a lot of the resources to support. We don't want people from the South Bronx to feel that they don't get the same resources that anybody else in the Bronx, Northwest, or in Manhattan receives.
Yeah. Community's big. I mean, the summertime is going to come. You're going to be doing block parties and create the awareness that the Lincoln Hospital is here doing great things in our community.
Yeah.
I know how passionate you are about it, because we've worked together in the past doing a lot of it. So that outreach is so very, very important. As the CEO of Lincoln Hospital, what role do you see community engagement playing in your leadership style?
Oh, Bob, I think it goes hand in hand, because I always look for an opportunity to collaborate. One of the things that I always say, I want everyone to see us like a hospital without walls. I want them to come to us for what they need. Sometimes people want to have a gathering, an event, an outreach, an education event, and I open the doors of Lincoln, because I want to make sure that they can come in. It doesn't have to be associated with just coming in when you need to see a doctor or see someone, or you need to have a procedure, or you don't feel well. Come in and partner with us. I think that having a partnership with the community leaders, community elected officials is important. Not only for knowing that we're here, familiarizing themselves with the services that we have, marketing for us, talking on our behalf. Word of mouth is the number one best marketing tool. Yeah. But also because I'm always going to be, as a CEO, I'm always going to be looking for resources, financial resources, because we can have a great idea, great concept, great planning, but if we don't have the resources, and for that we need partners like the elected officials. Yeah. They're very committed and very supportive, but I need to continue to highlight the importance of us collaborating and having community leaders that partner with us to do, maybe a partner so they can do part of what we do. They can get referrals from us. We can refer to them. Partnerships, that's what I'm all about. Being a social worker helped me understand that more than anyone else.
There you go, partnerships and relationships. Yeah. So who are some of the elected officials that have their sleeves rolled up out in the community, helping you get the things done that you need?
Let me tell you, I have to say everyone has been great. I cannot highlight anyone, Bob, because you're not going to get me in trouble. But the ones that I have approached, they either approach me, they find that Lincoln is an iconic place. Yes. And everyone, I have to be honest with you, everyone has been very supportive. Yes. Obviously, I can name a few, Councilmember Salamanca, Rafael Salamanca, Assemblywoman Amanda Septimo. Our borough president has never said no to anything, Vanessa Gibson. Everyone has been very, very close to us and knocking on my door. I'm also waiting to meet with our Congressman Richie Torres, our Senator Serrano. I met with him already. Everyone that I approach, either they're approaching me or I approach them, they understand the importance of Lincoln Hospital, which makes my job so much easier. Yeah,
and you know how to get the message out to them. Hey guys, I need it. Let's have a big meeting.
Oh,
we
you
need
heard?
to move. Yeah. Oh, you do have one.
No, I listen. I'm not shy. I'm not shy, and they
it's
know
coming up.
When I'm knocking. I'm knocking.
Yeah, let's knock on those doors.
Yes.
Let's move together in the same direction for a common cause. And
of
you're
course.
helping the community. You need help from a lot of other people who
absolutely
can help get the job done.
Yes.
Right? So where do we go from here? What's next for Cristina at Lincoln Hospital?
I'm trying to identify some clinical resources. I want to have a cardiac cath for Lincoln, that the patients that come to us, they can get the same level of care. We don't have to transfer them to another hospital in Manhattan because they can't get it here. The people in South Bronx need to be, have access to good, excellent health care. And I'm also, my big ticket item, I'm working with some of the elected officials that they're giving me some guidance, because I want to have resources to build a new ambulatory care building in Lincoln.
Oh, yeah.
Yeah, that's a major ask. I know it's not going to be easy. This is going to be, it's going to be, it's not a one person helping me with this. It's everybody collectively have to come together. Yeah, no,
Yeah.
it's a big need.
It's a big one.
It's a big need. It's a new building, having so we can increase access, making sure that the patients have access to ambulatory care, more access, more doctors, and more specialties. Getting state-of-the-art technology equipment. We partner with everyone for that.
And that's what you're most excited about for Lincoln's future going into 2025 and beyond?
Absolutely. Absolutely. I have the right energy. I have the right partners out there. I have people that understand the need of Lincoln Hospital. They're very committed. My employees also, most of them live in the community, so it's kind of like a full circle. They help me, they help the community, by helping the employees, we help the patients. It's a full circle. You can't go wrong here.
Yeah, I'm loving it. I'm
Yeah.
loving everything that you're doing.
Thank
because
you.
I know your history. I know what you've been through,
Yeah.
and I know what you're going to bring to Lincoln.
Thank you, Bob.
Yeah.
Thank you. Thank you for your partnership, and thank you for sharing my vision here. This is what we need to do together because it helps the Bronx, it helps the South Bronx, who's, basically the people in the South Bronx deserve the same, the best.
Hey, everybody's going to be under one roof up at the caucus weekend.
Yeah, absolutely.
We can help get the message across.
Thank you, Bob. Thank you.
Cristina Contreras, thank you so much. And we want to thank everybody for watching. And remember, you can always watch Inside Lincoln Hospital, Heart of the Bronx, anytime, anywhere, BronxNet.org and YouTube. And while you're there, be sure to follow BronxNet on social media to stay updated. From BronxNet's media and technology studio in the South Bronx, here we are. I'm the Dr. Bob Lee, along with my girl, Cristina Contreras. You don't mind, right?
Oh,
I'll see you next time on Inside Lincoln Hospital, Heart of the Bronx. Take care. Catch you another day, another way. I love you all. Peace.
Round of applause for the good catch award recipients. Go, go, go. That's a good catch. Coming, go, 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 go. That was a good catch. Go, 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 go. That's a good catch. Go, go. That was a good catch.
GDLU, guns down, life up. Go, 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 Lincoln. Health issues, come to Lincoln. You got a bruising, come to Lincoln. If you injured, come to Lincoln. You got a problem, come to Lincoln. Best doctors, best nurses, come to Lincoln. Say go, 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 Lincoln. Say go, 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 Lincoln. GDLU, BXP, go cool. GDLU, guns down, life up.
Go, Lincoln. Go. That's a good catch. Coming, go, 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 go. That was a good catch.